Hey everyone, welcome back to The Explainer. Today, we are decoding a massive medical mystery that so many of us experience, but honestly, we often just brush it aside. We're getting into the science behind constant exhaustion and why your body might actually be sounding an alarm you literally cannot afford to ignore. You know that feeling where you're just constantly drained? Maybe you're dizzy, weak, or completely out of breath after doing something as simple as carrying the groceries? You might think, well, it's just the symptom of a busy life, or maybe a lack of sleep, or just getting older. But actually, it could be a major sign of anemia, which is a highly common blood disorder. This isn't just your everyday run-of-the-mill tiredness. It is a crucial medical signal. To give you an idea of just how common this is, consider this staggering statistic from the World Health Organization: 1.62 billion. That is the number of people globally who are affected by anemia. We're talking about nearly a quarter of the entire world's population. So if you're out there struggling to just get through the day because of severe fatigue, you are absolutely not alone, and what you're experiencing is completely valid. So here is our roadmap for today. First, we'll cover what anemia actually is. Then we'll recognize the symptoms, break down the causes and types, look at how doctors diagnose it with blood tests, and finally go over treatment and prevention. Section 1. What is anemia? Okay, let's dive right into this and uncover the physiological reality of the condition. At its core, anemia is a condition where your body just doesn't have enough healthy red blood cells, or it doesn't have enough hemoglobin. Think of your red blood cells like a massive fleet of delivery trucks, right? And hemoglobin is the actual cargo boxes packed inside those trucks. Their entire job is to carry vital oxygen from your lungs to every single part of your body and then haul away the carbon dioxide. When your hemoglobin decreases, those delivery trucks are basically running empty. Your body tissues receive way less oxygen, and that specific oxygen starvation is exactly what causes the weakness and fatigue. Your cells simply cannot produce the energy they need to keep you going. Section 2. Recognizing the symptoms. Let's look at how this lack of cellular oxygen actually manifests in the human body. As you might guess, the most common symptoms are tied directly to that lack of oxygen. We're talking persistent fatigue and weakness. You might notice pale or even yellowish skin, especially in the mucous membranes, like inside your mouth or right under your fingernails. You could get headaches, shortness of breath, or feel super dizzy, particularly when you stand up fast. Your heart might even beat rapidly or erratically because it's struggling so hard to pump what little oxygen you do have around your body. Plus, you might constantly have cold hands and feet. I really want to emphasize this. Persistent fatigue is a medical signal, not a personal failing. It means your body is working in absolute overdrive just to maintain its baseline functions. And this next symptom brilliantly illustrates just how desperate the body becomes when it's starving for nutrients. It's called pica. Pica is a condition triggered by severe anemia where people develop intense, undeniable cravings to eat non-food items. We're talking ice, dirt, or even clay. It is this incredible physiological response where your brain is practically screaming for the minerals it lacks, making you literally crave a handful of ice for dinner. Section 3. Causes and types. Let's shift our focus to categorizing the diverse landscape of anemia so we can understand the different culprits at play here. Because, there isn't just one type of anemia. The most common one by far is iron deficiency anemia. Without enough iron, your body literally cannot make hemoglobin. This is usually caused by a poor diet, heavy menstruation, pregnancy, or even hidden blood loss from things like internal bleeding or ulcers. Then you have megaloblastic anemia, which is a vitamin deficiency, usually meaning you're lacking B12 or folate, both of which are critical for red blood cell production. There are also bone marrow problems like aplastic anemia, inherited disorders such as sickle cell anemia or thalassemia, and hemolytic anemia, which is where your red blood cells are actually destroyed faster than your body can even replace them. Now, what's really fascinating about these deficiencies, and honestly a bit scary, is the critical difference between lacking vitamin B12 versus lacking folic acid. While both will cause your body to produce abnormally large red blood cells, a B12 deficiency can cause severe, entirely irreversible neurological damage. We're talking numbness, tingling, and cognitive issues if it's not treated right away, often with direct injections. Folic acid deficiency, on the other hand, lacks those severe neurological symptoms and is usually just treated with an oral supplement. It is incredibly important to get properly tested because taking extra folic acid can actually mask the warning signs of a B12 deficiency while allowing that irreversible nerve damage to just quietly continue in the background. To really visualize what happens when the blood-producing factory itself breaks down, compare a normal, healthy, highly cellular bone marrow that is busy manufacturing your red blood cells to the bone marrow of someone with aplastic anemia. The aplastic marrow is essentially empty. It's mostly fat cells and has very little blood-producing tissue left. It's a stark contrast that shows exactly why the body is physically unable to produce enough of those delivery trucks. The factory has entirely shut down. Section 4, diagnosing with blood tests. Let's move in to the clinical side and decode exactly what doctors are searching for in your blood work. The absolute first step is usually a complete blood count, or a CBC. Doctors are looking closely at your hemoglobin levels. The World Health Organization actually has specific cutoffs for diagnosing this. For adult males, it's falling below 130 grams per liter. For non-pregnant females, it's below 120. And for pregnant women and young children, that threshold is below 110. Falling below these specific numbers officially confirms the diagnosis. It proves that your blood is literally running low on its oxygen-carrying capacity. But diagnosing the anemia is just the first step, right? Doctors still need to find the underlying cause. So they use a metric called mean corpuscular volume, or MCV. Think of MCV as a microscopic tape measure for your red blood cells. If you have microcytic anemia, it means your cells are unusually small, which strongly points to an iron deficiency. If your cells are a normal size, which is called normocytic, it could be due to sudden blood loss or chronic disease. And if you have macrocytic anemia, your cells are actually unusually large, which, as we discussed, usually indicates that B12 or folate deficiency. Also, just a quick note on this. To prove a true iron deficiency, looking at serum iron alone just isn't enough because it doesn't reflect your body's total reserve stores. Doctors have to test your serum ferritin, which is a protein that binds to iron. If it's less than 30 micrograms per liter, your iron stores are completely depleted. They'll also look at transferrin saturation, which is the protein that transports the iron. If less than 20% of your transferrin is carrying iron, it indicates a functional iron deficiency. These are the medically approved next steps to pinpoint exactly what's going wrong inside. Section 5, treatment and prevention. Let's move into the final stage of our journey today, focusing on empowerment, actionable steps, and recovery. Treatment almost always starts with your diet, but here is the kicker. Not all dietary iron is created equal. You have heme iron, which is found in meat, poultry, and seafood. This stuff is highly absorbed by your body, sitting at about a 15 to 25% absorption rate. Then you have non-heme iron, found in plant foods like spinach, beans, or dry fruits. This is much more poorly absorbed, usually around just 1 to 6%. But I have a crucial life hack for the vegetarians and vegans out there. If you pair non-heme iron foods with vitamin C-rich foods, like maybe having some strawberries with your spinach salad, you drastically boost your body's ability to absorb that iron. Beyond adjusting your diet, medically backed treatments depend heavily on the specific cause we identified earlier. For iron deficiency, doctors will often prescribe iron supplements, like 325 milligrams of ferrous sulfate. For those vitamin deficiencies, you might need vitamin B12 injections or oral folate. In really severe cases, a blood transfusion might be necessary. And, critically, doctors always have to treat any underlying disease or hidden bleeding that's causing the loss in the first place. One massive warning here, though. You should never, ever start high-dose iron supplements without a doctor's confirmation. Taking more iron than your body actually needs can cause some really serious medical problems and organ damage. So, to summarize our explainer today, let's lay out some actionable, everyday prevention strategies to keep your red blood cell fleet fully stocked. Step 1, eat a healthy, highly diverse diet rich in iron, vitamin B12, and folate. Step 2, promptly treat any underlying blood loss, like heavy periods or GI issues. Don't ignore them. Step 3, as strongly recommended by the WHO, waiting at least 24 months between pregnancies allows maternal iron stores the time they need to fully replenish. And Step 4, get regular medical checkups and CBC blood tests to catch any deficiencies early on. Anemia is incredibly common, but it is highly treatable, and getting an early diagnosis can prevent a lot of serious complications down the line. So, I'm going to leave you with this question. Is your persistent fatigue actually a crucial medical signal that you really shouldn't be ignoring anymore? If you are constantly exhausted, struggling to focus, or getting winded just walking up the stairs, please consult a doctor and get your blood tested. Don't just assume it's the stress of modern life weighing you down. Thank you so much for learning with me today. Don't forget to like, share, and subscribe for more health and medical explainers. Catch you on the next one.